Hello, my name's Tim Pigott. I'm the incoming president of EUROSPINE. I'm talking to Spinal News International from EUROSPINE 2018 in sunny Barcelona. Firstly, it's important for patients and for surgeons to understand what's happening to their patients and what the outcomes are, and also in terms of non-surgical specialties to find out how their treatments are working. Secondly, governments are increasingly requiring outcome measures as a way of demonstrating efficacy in terms of economic principles. And thirdly, the medical devices industry have been increasingly regulated and will require outcome data in order to be able to continue marketing their products. Outcomes are really important because it's not right if we don't know what we're doing to our patients. Outcomes traditionally have been very clinician-based, and over the last few years there's been much more import on patient-reported outcome measures known as PROMs. The advantage of this is it's completely separate from the clinician. It's done independently, and you get a view of how the patient feels about the outcome of the procedure or intervention they've had. At the moment, I think it's a real struggle for people to collect outcome data because it's actually very difficult. If you're going to collect outcome data to 2 years after an intervention, that requires finance, organisation, administration, and to get an 80% outcome figure, which is probably what we require, is extremely difficult. So it's really providing that resource to allow people to be able to undertake the research. I think the Spine Tango initiative of EUROSPINE is very helpful in this regard. It's a long-standing registry with fully validated PROMs measures within the construct. It's been going now for 15 years. There are over 100,000 patients on the database, and there's a real depth of knowledge on how to interpret outcome data with over 70 peer-published publications over the last 10-15 years. Junior doctors' hours have been reduced over the years, which is entirely appropriate because they were too long. And this has meant that we have to focus our educational activities in the time available. So we're looking particularly with looking at blended learning, e-learning, interventions in cadaveric labs, looking at group discussion, didactic learning. So really a blended package of learning to try and help support this. The key goals are the 4 missions really of EUROSPINE, which are education, research, quality assurance, and providing good services for the members. In terms of quality assurance, we've already talked about Spine Tango. We're also initiating a project of hospital certification to allow them to be badged as spinal centres of excellence. We're distributing research grants. Over the last 6 years, we've distributed over £1 million worth of grants, and we're continuing with our educational courses, and we're obviously wanting to increase our membership and provide good services and better services to our members.